Hello and welcome to this edition of EC3 Medical Moments. Today we're going to bring you a new update from the Lincoln Trail District Health Department, and joining us is a new face, Brian Carroll, and Brian is the Environmental Director for the Health Department in this area. Brian, we're going to remove our mask. I wanted to show individuals at home that we do follow the state guidelines, and we are at our 6-foot distance here. Which is something that, with the opening of schools coming up just around the corner, and also teams involved in sports and things, your job has become, I know it's always been important, but it seems like you are probably the person, the go-to person, when it comes to businesses and offices and what the regulations are and what people should be doing. So for those at home, Brian, tell us a little bit about your role with the Health Department.
Sure. Well, as she said, I'm the Environmental Director for Lincoln Trail District Health Department. And what we have always done in the Environmental Department has been really enforcement of the Health Department side. And so we handle all the food establishments in the area, inspections of those, public facilities such as motels, hotels, pools, tattoo studios, things of that nature, and also the private on-site sewage department as well. So anybody that's not connected to city sewer that has to put in a septic system, they go through our offices in our 6 counties to make sure that everything's done properly and by reg. So, but in addition, now we're in the COVID phase. All the governor's executive orders have been really put on the health department to enforce. And so since environmental is already in that role, we've taken that on as well.
Well, and for those at home, how many counties do you all work
We have
in?
6 counties, so and this is not in any certain order. I just thought we start from north to south, but we have Meade, Hardin, LaRue, Nelson, Marion, and Washington County.
Now, moving forward, Hardin County, of course, is the largest county that you oversee. How has your role changed with COVID? And you mentioned that it's amped up, but I'm assuming there are not a lot of new regulations that come into play almost daily.
Sure. Oh, yeah. It's a very fluid situation. We're constantly having to watch, the governor's press conferences to see exactly what our role is going to change and how it is going to change, what we're going to be expected to enforce or to do. And it's a pretty reactionary role right now and stuff. So we find out pretty much when everyone else does on when that's going to happen. And so then we reach out and try to get as much information and follow up to be able to guide and educate people accordingly.
Now, when we started rolling out with mandatory masks, standing 6 feet apart, not doing this, not doing that, were you able to present those from the state, or are those things that you've had to kind of go in and tweak a little bit for our areas? No,
I mean, the mandate and executive order is pretty clear on how it's spelled out, and it's simply a matter of just educating people. Honestly, we're there to educate and encourage people. We're not there to lay the hammer down and really get people in trouble. We just want to keep mitigate the spread, keep everybody healthy as possible, and by wearing masks and social distancing and proper hygiene, that's the only way it's going to happen.
Now, with schools opening, you all have worked hand in hand with the school districts. What are some important things that parents need to know about that particular, the reopening plan?
Sure. Well, and that's still a work in progress, I would say. Kentucky Department of Education has done a great job in terms of giving out guidance to all the public schools and the districts in the area and stuff. And then we've coordinated with them as well to really, you can put out all the guidance you want, but there's always a few scenarios and gray areas that just are not addressed or in writing. And so we work with them to try to fill in those roles. The only thing I can say really as far as to parents going is that it is allowed for them to go to school all the schools, I promise you, are working diligently to make sure that they are doing everything possible for the safety of the students and the staff that work there as well. So, you know, I would feel comfortable, let's put it that way, sending my child to a public school, you know, knowing the regulations and steps that are in place currently.
And what about our sporting teams, our athletic teams?
Mm-hmm. The same thing with them as well. There's really good, clear guidance from the governor's office and also from KHSAA and stuff like that that they reference that puts them in a really good place in terms of how they're, you know, proceeding and the steps they're putting in place for practices or for game day events, competitive events as well. So the real key with all these things and all the steps they put in place is that there could still be COVID happening in a school or in a team, but those steps are there to really help mitigate it and limit it to just one or two individuals and not spread team or school-wide.
Okay, and that's real important. We know that COVID is in this area.
Mm-hmm.
We know that there are probably hundreds more people that probably would test positive just because it's there. How do we handle that asymptomatic group? And what is your role in that?
Well, and that's the thing, is just that it is community spread, like you said, right now. So you just have to assume everywhere you go that it is probably there. There's very likely an individual or somebody that's there that is positive for it or has it and may be asymptomatic. So that's where mask wear is, social distancing, proper hygiene, washing your hands after going into places like that or using hand sanitizer, and just assume that's the case and protect yourself accordingly.
Well, and I would assume that there were a lot of businesses that did really well, and organizations and such. So those are the ones that you really want to, you know, yay, thank you for doing this. You make my job easier.
Exactly, and all the businesses that came out with their own mandatory mask, such as the Walmarts, the Sam's, the Targets, the Krogers, really applaud them. It really makes our job easier in terms of enforcing that order and stuff. And if they go on and do it, then that's encouraging. It filters down as well to all other businesses as well want to follow that lead and do it.
Mm-hmm. I don't want to call you the environmental police, but you probably do get those calls. And are those calls really, have we had a danger issue?
No, I wouldn't say a danger issue. Most in their complaints, all the complaints do come through the environmental department and stuff for any public facility.
What are those usually?
Usually it's in regards to maybe masks not being worn and stuff with the mask ordinance. But also sometimes too, there's some confusion out there about the group ordinance out there in terms of where it lowered from 50 to 10 and stuff out there. Well, people I think assume that that's affects public places as well. That's not the case though. That's only for social gatherings. So for example, you go to a grocery store, obviously there's more than 10 people there. They have their own set of guidelines that they follow that's based upon the capacity of that building. And so most public facilities and public entities and businesses have their own set of guidelines that they follow. And the 10 or less rule really is in regards to more social gatherings, birthday parties, things you would hold at your house or backyard to really contain that spread.
Mm-hmm. With your role, who helps you do what you do?
I've got a staff of approximately, including myself, there's 10 environmentalists that handle these 6 counties. So we're not exactly, staffed accordingly to handle something big like this. But the one thing I could say, especially early on in the whole response program, is that we did stop some of our programs and put a stop. For example, food establishments, food inspections, things like that. As the governor would term it, we didn't want to be a honeybee. We didn't want to go around and go into these places and possibly be, attributing to the spread. We did some interesting things. We were the first in the state to do virtual inspections. So we would call them and then set up times and do it over Zoom or Skype or FaceTime. And we would see all the important information and go down through our inspection sheet and able to do some of these, make sure that these places are doing the proper hygiene and sanitization protocols they should, all the food safety issues they should be doing as well, but you're not attributing to the spread at all. And so those were some of the things we have implemented. Now, once the public was allowed to go in and eat in these restaurants, we've put our environmentalists back in the position to do that again, but we've still kept that model in terms of maybe there's a follow-up inspection or something we want to come back and check. We're doing that virtually still and not having to go back a second time.
I think we are all doing things differently, and good things coming out of this is hopefully better sanitation and washing your hands and using hand sanitizer and not coughing.
Right.
The mask wearing gets a little bit tedious, but I think we've all gotten accustomed to that as well. If anyone does have a concern, what do they need to do?
Well, I mean, they're more than welcome to contact us at the Health Department. We also have an environmental complaint line that they can reach out to us as well. But those are the one way. The website ltdhd.org. There's lots of really good information on there, and I encourage people to go there and review it. And a lot of the complaints we get are really just misunderstandings. Sometimes is what we find. Some of them are valid, some of them are not. And it's really difficult in this time for business owners, I would say, to be put in the position they are. I mean, some of these small businesses, and if one person comes in there without a mask and does shopping for a short period of time, there could be 2 or 3 complaints be called in on that individual. It's a very difficult situation to be in. So whenever we go out, it's more about, we do investigate these complaints though. These are not just filed away. We do make a call, or if it's multiple times, we'll go out and do an actual inspection on that place to see the validity of that. And if there's signage up, the management really is doing the things right, putting forth a good effort to enforce these, then that's usually all we can ask of them at this time.
I think the next thing that will probably affect this area is when the sports do start and the number of fans and where the seating is and things like that, especially the indoor volleyball and things such as that. So I guess that's going to be something that's going to be coming up on the radar the next month or so. Yeah,
there's talks about it still, and it's all relative to how the public right now handles this, how well they use these masks, how well they social distance. If we can keep these numbers going in a downward trend, I see sports happening in the state. If they're not able to, or irresponsible in the way they handle themselves in public, we're going to see the numbers continue to go up, and unfortunately, things like youth sports are going to suffer because of it.
Exactly, and we don't want to do that.
Not
we
at all.
Really don't. Brian, thank you so much for coming in today. We're going to share this show with Terry. She's going to bring us up to date on the numbers locally, and since our last month, a lot of things have changed, and we've seen the highest numbers ever. So thank you again, and thank you for all you do for the Lincoln Trail District Health Department.
Thank you for having me.
Okay. Hello, now we're going to continue our second segment on EC3 HOSA Medical Moments. Joining me is Terry Bergen, and she is the Public Information Officer for the Lincoln Trail District Health Department in this area. And Terry, we're 6 feet apart, so we're going to remove our mask, but we want to practice those good modeling skills that we do wear our mask and we sanitize, and we want to make sure that our guests feel safe coming into our space.
Thank you.
And likewise, that I feel safe when we take temperatures and wear our masks and follow those guidelines. It's been about a month since we were together, and a lot has changed in that time, but some of the things that we talked about with when there are more people in a group or out together, there's going to be higher numbers of positive COVID cases. So bring us up to date currently what we look at.
Well, I think one of the points that I really want to stress is that COVID-19 is widespread. It's in our communities, and you should not feel safe when you go out into a community without a mask. Just because you feel well and you are asymptomatic, you may be one of those people who feel well and are asymptomatic, but you still should wear a mask because there are others who are at higher risk, who are put at higher risk when you don't. Our numbers have increased since we last talked. As of June 30th, we've increased by 144% in the number of our cases. Hardin County, as of yesterday, had a total of 523 cases. LaRue, 63, Marion, 98, Meade, 96, Nelson, 191, and Washington 63. We went over 1,000 cases yesterday, or over the past weekend. So our total cases for all of those 6 counties equates to 1,034. Now, one of the things that I do want to stress, Gina, is that a lot of people feel like we're duplicating the numbers, that people are being retested over and over, and that's making our numbers higher. I want people to know that the 1,034 are a positive test for a different individual. There is no duplication here. There is not people going back getting retested. These are one positive, one person. So there is no inflation in the numbers at all here.
Okay. Mm-hmm. Now, is it accurate to say that if someone has had COVID, they've isolated at home, do they take a follow-up test?
Sometimes a lot of employers, especially if they're working, will require that they do a test before they return back to work. So yes, they may be required to do that. But we look at it more from a symptoms point of view. If you are quarantined or you are isolated. So isolation means that you are the person who has COVID-19. You're the one who has the illness. Quarantine applies to people who don't have the illness, but may develop symptoms because they came in contact with somebody who was sick with COVID-19. There's a difference in the quarantine days and isolation days as well. Someone who is isolating or who has COVID-19 is asked to isolate for 10 days. Someone who quarantined or who is a close contact is required to quarantine for 14 days. Now, the definition for a close contact is someone who has spent 10 minutes or more and stood less than 6 feet from someone who has COVID-19. So individuals, and I feel like I may have forgotten the question, but individuals are asked to quarantine or isolate depending on how they are defined.
Okay. Mm-hmm. Now, nationally, they still say that there are issues in getting those tests back, the results back. Recently, in a situation in my own family, the individuals that had gone to Hard Memorial, their tests were back in a very short period of time. Within 2 days, maybe even the following day. But then the other individual had gone to a different facility, and it was work-related, and it took almost 10 days to get that results. Is that common?
Yes. I mean, there are so many different labs that are, or people who are testing now, and they're using various labs, and they could each have different times on when that test results are returning. We're averaging, as far as when LTD-EHD is notified, Lincoln Trail District Health Department is notified, about 5 days. But it can take up to 10 days, even before the testing increased to what it is now. Some of our labs took 14 days for the results to return. So there's still that variation in when the labs return, when people are notified. Yes.
How many are isolating at the present time in terms of cases?
Well, we have currently on home isolation 212 people, and then 8 people are in the hospital. So that's our present number as far as home isolation is concerned.
Is Hard Memorial the hospital that all the patients are still
Well, not necessarily. I mean, we cover 6 counties. There's 2 other hospitals in our county, so Flagey and Springview as well. So we have the way the numbers are right now, it would be Hard Memorial, when we look at it.
Percentage-wise, you mentioned that in our pre-conversation that basically the counties are all ticking about the same amount. And even though they're very different in terms of population and traveling, is it just because the spread is kind of the same in each of those counties?
Well, no, there are different factors. Okay. You know, we know for a fact that, as I mentioned at the opening, that it's in the community, right? But different things affect different factors. A lot of times, they don't have the resources available in the rural populations that they would have in a more populated area. And our rural population has an older population. So those individuals are at higher risk anyway. And so they suffer more when they contract COVID-19. And then if you have a situation where individuals are not wearing their mask, or if they're not physically distancing, all of that comes into play when you look at who's getting infected and the rates that we have for each of our counties.
Mm-hmm. When we look to open schools in the upcoming weeks,
Mm-hmm.
Hardin County Schools has worked very diligently with your office, and we are moving forward with face-to-face instruction on August 24th. We also have our online learning academy, and other districts in the area are doing something different per se. I believe Elizabethtown Independent is going to be online, and Meade County. Have you all worked with those other counties? As I know you've worked with us, I'm assuming it's the same process?
It is. It's the same process. Okay. A lot of schools are sending their plans once they've created them to our environmental director and our director of community services to get a input from the environmental and the health aspect of it. So yes, all of the 6 counties within the schools districts within our 6 counties that need assistance, they are reaching out to those 2 people.
Right. Mm-hmm. And we know it is a local school board decision, and but we're also guided, I guess, by the governor in regards to if he says immediately, everybody's got to do this, we take on those orders. And I know that you don't, everybody wants that crystal ball.
Yeah.
They want that, okay, tell me, is my child going to be safe? Are we going to do this? But from your understanding, we are doing Hardin County Schools, we follow the protocols, we've got those guidelines in place, and like you said, individuals may come up and test positive, but our goal is not to have a massive spread.
Yes, and see, one of the things that I want to stress here is that you can kind of control your environment, right? So the schools have preventive measures in place to mitigate the spread of COVID-19 within those institutions. So the wild card is the students that come in every day, because you don't have the ability to control where people go, if they wear masks, if they physical distance, all of the things that we keep promoting. You have no control over that outside of your own environment. And so because of that, even with all of the steps that you take, there is a chance that COVID-19, a positive case, could enter into the schools. But having certain things in place helps to mitigate or reduce the chance of that. And so that's why all of those plans are important to have in place beforehand.
Right. And those plans are available for anybody that is interested. You can go online to Hardin County Schools, Elizabethtown Independent Schools, and again, the websites that we continue to talk about that show so much great information. Tell us a little bit about those websites and where people can go.
Well, KY COVID-19 is the state website. You can always go there. They have really good information there. And then ltdhd.org is another website. The Centers for Disease Control also has very good up-to-date information. And actually, you can link to all of that off of our website, ltdhd.org.
What is there a common thing that you're seeing now in the cases, the data? Is there a movement that you're noticing? And so therefore you have to redirect?
Well, our messaging doesn't change because, until we get a vaccine, and we still don't know when that is, we're hoping by the end of this year or the beginning of 2021 is what is being said by those officials, health officials now, federal level. Until then, the only thing that we have at our disposal is the wearing of the cloth face mask or the facial coverings when you're out in public, the physical distancing, and washing your hands often, 20 seconds or longer. And those tools are not to be poo-pooed. They work. We know they work. They sound so simple, but they are really good at helping to reduce the spread. So one of the things that we've noticed, well, some of the things that we've noticed in the cases is that cases among young adults 20 to 29 years old have increased by 176%. This is since June 30th. This is what I'm looking at, the time frame. So it's June 30th until last week. It may have gone up even further. So last week, Friday, okay? Cases among the Hispanic population has increased by 68%. People of color account for 20% of our cases within our 6 counties, and 30% of our deaths. Now, people of color only make up about 14% of the population. So when you look at those, that's just too high. And this is kind of aligns with what we've been hearing in the news about the disparities related to people of color. The number of new COVID-19 cases with comorbidities or existing medical conditions has decreased a little bit, so about 10%. It dropped by 10%. We're noticing additional cases in churches, in child care facilities, and at large gatherings.
And these large gatherings is not the Walmart.
No, it's people getting together, and they're having family gatherings, these large that type of gathering, not the Walmart, that type of stuff, that type of thing. The largest number of infections continue to be among females. The average age about 42.3 years old, and then approximately 20% of all cases are asymptomatic, and that's where it's kind of been with us. It's kind of hung around the 20% remain asymptomatic, so they don't know that they have COVID-19. Awesome. So those are the trends that we're seeing. One of the things that I really want to stress is that nobody's immune. I mean, we've got it all over the place. We've got the young, we have the old, we have the high risk, we have the Hispanic, we have all people of color. No one is immune to COVID-19. And so in severe cases, it can take up to 6 weeks for people to recover. There's a lot of things that I've been hearing on the news or people making comments about, well, 99% of the people recover. But the road to recovery is different for everybody. You may be one of those individuals who have very mild symptoms. Is that not that big of a deal for you? And then we have some individuals who it takes them 6 weeks to get over it. And then we don't know as we learn more and more about COVID, what the long-term effects are of this virus. But what we do know is that survivors of any age can have long-term irreversible lung damage. This is more and more data that's coming out. So our fight with COVID-19 continues. And it will continue for a long time. And it's very important that people get into that frame of mind. We're going to be fighting this for a while.
Right, it's going to be here for a little bit. Well, thank you all. Thank you and your department for all the work they do.
Yes, you're welcome.
For those at home, go to the websites, look at the facts.
Yes.
Those are true facts. They're not fairy tale. And we're not trying to cover it up in any way. It's in our community. Individuals that will be testing positive, but there is hope.
There's hope.
And we keep working together.
That's right.
All right, thank you again, Terry.
You're welcome.